Antonio Mancuso, and is supported by SciCan, makers and distributors of high-performance products for dental professionals.
And now all the restorations have been cured, approximately with a halogen light, about 1 minute to 2 minutes per restoration. And now we're going to be starting our cleanup. So I like to use a flame-shaped 7901 carbide, multi-fluted, and go around the perimeter under loop magnification to remove all the excess cement. I like to use a conventional H67 scaler to actually scratch the surface of the porcelain. You are not able to scratch it, but if there's any composite, you'll be able to see it as black markings, or you'll see it flake off as very, very fine particles. Very good. Let's check our contacts now with floss. Cute. Cute. Probably get a few pieces of floss for me. I'm able to get through all my contacts, but I just want to demonstrate, if you are unable to get through a contact, then you use something called a contact breaker. And the contact breaker is applied at the incisal embrasure. You support the gingival aspect of the contact with your opposite hand, and lightly in a sine fashion, applying an apical pressure, you're able to go through the contact. And as you saw, there was a bit of a give, and your finger protects the gingiva from being lacerated. And I typically will go through all the contacts in like fashion just to remove any excess cement. Open just a wee bit, Jack. Now, Jerry, you may hear some cracking. I am not breaking, I promise, breaking your teeth. What I am doing is breaking the cement, but you will hear a crack when I break that cement seal between your teeth, okay? And it's important to let the patient know that, otherwise when they first hear that instant crack when you break the contact, they imagine all kinds of crazy things like breakage of teeth, etc., etc. Okay, we're able to go through all of our contacts. We'll try one more time with the floss, make sure that there's no problems with flossing. There we go. Very good. At this point, we're going to go around the margins and do a little bit of polishing with our dialite system. And again, we're going to wash that. Okay, and we are ready now to remove the rubber dam and check our occlusion and doing the finalization of the case. So now, Jerry, I'm going to play with your bite because you got some excess cement up there. So that's the next part, okay? Thank you. And just gently bite down first of all, Jerry. Just want to get an idea where you're at. And open. and just bite down again and open and bite down again. Good. And again now, and open, and again, and open, and again, and open. Okay, so we've got a few high areas. And again, Jerry, bite down, and grind around a wee bit. Great. And if you could repeat that again. Good. And bite on your back teeth, and now slide straight forward. Very good. And open. Have an Explorer, please. I'll go right to the paper again, please. Okay, Jer, bite down again. Tap, tap, tap. Grind around. Good. And repeat that again. Tap, tap, tap. Good. And now bite on your back teeth and come straight forward. Perfect. Thank you. I always recommend, if you're going to do your final equilibration on the case, to have the patient actually sitting straight up, or even better yet, standing up, putting the articulating paper between the teeth as I have in this position, and then bringing them back in the chair and doing a final adjustment of the case. So now we're going to just finish polishing the occlusal surfaces of the teeth of the dialite, and finishing up with a diamond impregnated polishing paste. Explorer, please. Suction. Just dabbing some of the polishing paste over all the teeth so that I have good distribution, and then I'll commence with the final polish. And we'll give it a nice little wash. Water, reflect on your side. Okay, Jerry, I want you to run your tongue up against the roof of your mouth and right up to the new teeth there. And if there are any sharp edges, any rough edges, if you could point them out to me. Should be pretty darn smooth.
Yeah.
Experience has dictated there's nothing more frustrating than having the patient fully up. The assistant has already commenced cleansing the area, and as the patient walks around, he notices with his tongue a piece of excess composite. So it'd be prudent to ask the patient at this point, rather than having him sit down again, getting the assistant to bring in new instrumentation and cleaning up that way. Everything okay? Feel good? All right, let's get you up and have you take a look-see. All righty? All right, now it's hard for you to see, Jerry, because your lip is numb, so I'm going to help you by lifting up the upper lip, and you can give yourself a fairly good look at what we were able to achieve for you. And you can see how that one tooth where the gum was fairly low, how we were able to achieve some form of symmetry between the left front tooth and the right front tooth.
Nice.
Very, very nice. Very nice. Now the assistant is going to spend a couple minutes with you, Jerry. She's going to do a final cure of the teeth with the laser, just to make sure that everything is fully cured and hardened. And then she's going to go over instructions on what to do in terms of caring for your teeth. Okay? We will have you back in approximately 1 to 2 weeks, just to see how you're doing, if there's any little nuances that need to adjust. Your bite may feel slightly off. That is not something for you to worry about. If it becomes a nuisance, please, all you have to do is give us a quick call and we could address that for you.
Very good.
Okay, any questions for me before I leave?
So far, so good.
All right, I'll leave you with Jackie.
Thank you.